They're often the first doctor you see when you need a checkup and essential in preventative care and getting prescriptions and specialist referrals. State data shows in 2023, upwards of 8,000 primary care doctors served Washington, a state with a population of about 8 million. And the shortage is worse in rural and underserved urban areas.
There are challenges, I think, both on the patient side and on the physician and clinic side.
Dr. Carla Ainsworth heads the Washington chapter of the Academy of Family Physicians and practices as a family medicine doctor. She says the reasons for the shortage are multifaceted.
On the patient side, we know that there are some folks who weren't getting care for the last few years, in part because of the pandemic, and so there's been an increased demand for new patient visits.
Ainsworth also points to more people moving to our area trying to get established as a new patient.
Yes, I moved from Yakima, Washington,
Kathleen
where
Ashworth is
I
among
was
those
using
newcomers seeking a new doctor, something that was important to her as a diabetes patient.
it's severe enough that if I did not have a regular doctor who has an old age view for diabetes, because how you treat diabetes in a 40-year-old is very different than a 77-year-old.
She found Dr. Ainsworth, who specializes in geriatric care. Ainsworth adds it's not only patients moving around.
It's also true that a lot of providers have changed. Providers have retired or they've also moved.
Adding to the complexity, medical students deciding their career paths may feel daunted by the long hours and workload associated with family medicine and general practice.
Part of the work we have to do is both have a bigger pool of medical students, and then we also need to do the work of explaining to them the joy and the satisfaction of being a family physician, and also making that a job that can feel sustainable.
That fulfillment may be hampered by what Ainsworth calls the administrative burden of primary care. She says doctors find themselves spending too much time charting medical records, obtaining prior authorization for care, and other clerical work.
And that has made it harder for us to take care of more and more patients over time.
This is where artificial intelligence could help. Medical circles are increasingly experimenting with AI. A JAMA study published this October found AI chatbots did a superior job of making certain diagnoses than human doctors.
Is artificial intelligence going to be at all a part of alleviating this dearth of family practice doctors? Is that conversation happening right now?
Absolutely. I mean, artificial intelligence has to be part of the solution. There's just too much work to do and not enough people to do it.
She envisions AI could be a useful tool for transcribing notes and following up on lab results or automatically summarizing pages of medical records.
Which allows me to do the thing of sitting side by side with a patient that I've known over time.
For now, Ainsworth recommends patients be open to seeing an available doctor who may not have been their first choice, even opting for younger doctors just starting out. Telehealth is also being used to bridge gaps in care.
I think you have to try not to worry about it. You have to take it slowly and just keep going.
For HealthLink, I'm Christine Pei reporting.